It's the most commonly diagnosed non-skin cancer in American men, as well as the second leading cause of cancer death. According to the American Cancer Society, 1 in 7 men will be diagnosed with prostate cancer in their lifetime, and nearly 200,000 new cases of prostate cancer will be diagnosed in the U.S. this year. Urologists say 90% of prostate cancers have no symptoms, making early detection key to its successful management. As prostate cancer screening becomes more controversial, many urologists believe it is important to balance data with a common sense approach to the personalized screening and management of prostate cancer.
We're dealing with a cancer that can affect someone for a long period of their lifespan. It becomes important to have an early diagnosis because it gives the opportunity for curative therapy that does not affect their lifestyle. If we wait and make the diagnosis later, then the options are less, they're more invasive, while if we can make that diagnosis early, this may just be a bump in a patient's lifestyle and then go back to normal.
They're looking for optimal disease control, and they're looking for the least possible impact on sexual function and urinary control. And so the goal is to be able to develop and offer a treatment that accomplishes that trifecta.
Oftentimes, when surgery or radiation is used to treat prostate cancer, it can lead to negative side effects such as impotence and incontinence. But there is a less invasive, relatively new treatment garnering great results: high-intensity focused ultrasound, or HIFU. Approved by the FDA to ablate tissue in the prostate using sound waves, HIFU is radiation-free, non-surgical, and is performed by a urologist as an outpatient procedure. Men return home the same day and are back to their normal lifestyle within a few days.
Those sound waves are highly concentrated through a focal point to treat prostate cancer. So they can be directed to specific areas of the prostate, usually in 3-millimeter strikes, so you can treat a specific area of the prostate and avoid damaging other areas of the prostate. That's a big advantage for HIFU, is that you can have less collateral damage while still killing cancer cells. HIFU is a very effective treatment for localized prostate cancer, and it would be on par with other treatment modalities for localized cancer: brachytherapy, surgery, external beam radiation, and studies have shown that results are excellent and comparable with those other modalities.
The issue, though, that worked out with me was that it was only in one side of the prostate gland. So when we had a chance to sit down and discuss the options, Dr. Constant explained to me that the HIFU procedure is an ideal procedure for someone in a situation like that, since we can save the other half of the prostate gland. I had it done on a Friday afternoon. I had one day when I felt a little bit tired. By Monday, I was back to work. I was back doing everything I always did. It was almost like nothing happened. It was fantastic.
Doctors Tortora, Peritzman, and Constant are 3 of the talented urologists that make up the Charlotte-based HIFU Prostate Services, established in 2015 to provide men access to a less invasive treatment option for prostate cancer. Putting patients at the center of everything they do, HIFU Prostate Services is partnering with leading urology practices and physicians across the country to help eliminate cancer and preserve patient quality of life.
HIFU Prostate Services does help me effectively treat my patients. It allows me to just be the physician and surgeon while they manage the intricacies of patient care and walking them through the procedure. So it goes hand in hand with effective treatment. And HPS does provide concierge service afterwards for up to 2 years for patients, helping them navigate the post-procedural landscape, monitoring their progress, and also maintaining data on patients.
In the war against prostate cancer, there is no substitute for providing patients with the compassionate attention and state-of-the-art care they deserve.
The best part about being cancer-free is you know you've been through it and you know it's gone. You don't have the worry in the back of your mind that might still be an issue with you. It's a big mental relief.
Now the direction is targeted therapy, analogous to breast cancer. Identify the actual cancer within the organ, target or treat just the cancer and a safe margin around it, but preserve the rest of the organ and minimize any of the side effects. And that's what targeted therapy offers to the patients.
We are coming to an era of personalized therapy. It's not one size fits all. We have the ability now genetically and chemically to specify what kind of therapy we're having and do specific therapy. And I'd like to tell patients what they should do is look at all their options and try to decide what's the best therapy for their disease and their health.
Don't let prostate cancer slow you down. Learn more today about HIFU Prostate Services, preserving the quality of life through non-invasive cancer treatment. For more information, visit HIFUProstateServices.com or call 877-884-HIFU.